The point is that we have a fallback position in that we have a lot of teaching hospitals and a lot of general hospitals, where we have the medical directors and chief medical directors members of the planning committee, and who have all been told that they should make beds available, and they are all ready for that. They have trained nurses and doctors there, and they can make space available at very short notice if the need arises. As you know, this is the same practice in many other countries of the world, where they now immediately make space available in the hospitals which they have. There's no country that can have all the numbers of beds as isolation centers waiting for you. So you have to have a method of making them available or creating temporary structures, if you like. In China, they had to build 2 hospitals in a very short time. In other places, they have to convert hotels or something into. So these are all steps that you take as fallback positions in case the situation arises, which we really hope we don't need to get to. As for what stage we are in, we're in the stage of what we call importation. The diseases are just coming as single cases. We are not in the stage of community transmission yet, where it's becoming widespread that people who never even traveled at all are getting it for people who never traveled at all. So we are in that early stage, and we hope that we keep in that level. That's why we are very focused on contact tracing, on identifying who has been in touch with the index case or the arriving case, and the NCDC is doing a great job here in supporting the states and the public health departments of the states to track and trace. And when need be, we publish the names of people we are looking for if we cannot find them, in order to be able to have the assurance that there is no gap. We also look at the airline that brought the person, if he came in by air, and inform the airline, inform the country. And if any of the passengers have moved to another country, we send a message to them through the World Health Organization that these persons have been in contact with a corona patient on board a flight. As for the strike of resident doctors, my information is that the doctors of the FCT, and we shall be talking to them, joining in talk to them. They actually report to the FCT local government. They don't report to the federal ministry. But we shall be joining conversation with them. I don't think that that's a good time to go on strike. You do not choose a time when your country is in emergency, and then you create a problem for that. That's not a good thing at all. I think that strike is ill-advised, and this is the wrong time, and they do not get any sympathy for choosing a time like this to withdraw services. As for the land border, yes, as I told you, our focus has been on air travel, because we did believe that most of the cases, if they do come here, because this is not an indigenous disease, if they do come here, they will come in by air. But the fact that somebody has been captured to a land border, case has been found there, shows that the vigilance is working. And the individual was identified, and he happens to be a traveler who's moving around, probably trying to, there were 2 of them who are probably trying to go around the world on motorcycles. I think they are adventurers, and so they entered here, and the system was able to identify one of them as positive. The other one is negative for coronavirus, and the needful is being done. We are working closely with immigration services. Yesterday I had a conversation with the Comptroller General of Customs that we should work closely with them, and work with them, particularly at the land borders where they have control. And we are going to conduct training also for customs and immigration officials on taking temperature and on identifying people who do not look well, and raising their index of suspicion, so that even if at that moment a health official is not there, they can call straight away and say we have a suspect. So that kind of collaboration is done all over the world, and in our case too, we are going to sharpen it. The heads of these 2 agencies have had conversations with us during the multi-sectoral meeting, and they are very willing to work with us. The ministers supervising the agencies have also expressed great interest and willingness to cooperate with Ministry of Health in order to defend our country and our people against imported disease.